Hey friend, welcome back. So just a few weeks ago, the CDC updated some of the mortality statistics from the year of 2020, and they released the top causes of premature mortality in the US during the year 2020. Now, the results of this was actually a surprise to a lot of people. I did a video, I'll post it here. Perhaps you have watched that. Now, in this video, I want to address some of the comments that I read because there was about 2,000 comments on that video. People were criticizing me, saying that I'm downplaying the seriousness of the vid, the COVID. I'm going to refer to that as the vid from here on out. And what I want to do is just clarify a few things because there was a lot of comments there, a lot of questions here. So if you hadn't yet watched that video, let's just quickly review what the CDC reported as the leading causes, the top 3 leading causes of mortality in the US. Now, if you were to survey a bunch of people randomly off the street, I would guarantee you that about 80 to 90% would say, oh yeah, the vid was the leading cause of mortality in the US during the last year, but it wasn't. You know what was? Heart disease, congestive heart failure, coronary artery disease, hypertension, high blood pressure. Diseases of the vasculature were the #1 cause of death in this country. In fact, they claimed that collectively those conditions were written on death certificates, which claimed 690,000 people last year. So what I'm going to do here is just put CVD for cardiovascular disease. Now, it's important to sort of pause and talk about this right here, cardiovascular disease, because not only did it claim far more lives than the vid, but it's the #1 risk factor besides age. So we know age is a risk factor for disease severity and mortality, but obesity and heart disease and hypertension and heart disease related comorbidities are the #1 leading factor that determine whether or not you're going to have a mild versus severe case or even end up in the ICU and even dying. Okay, so where's the outrage for the heart disease causing foods in our children's schools? Where's the outrage? Heart disease and atherosclerosis, which is the narrowing of the cardiovascular vessels. Guess what age? That starts at age 4. So where's the outrage? There's a lot of outrage for people that don't wear face masks at dog parks or walking on the street, but there's no outrage for all the people that are sitting and waiting to get dinner at Kentucky Fried Chicken or McDonald's. There's no outrage for the politicians that are signing bills like the Farm Bill and agreeing to voting yes on bills that subsidize junk food to make the Happy Meal $2.99, that is making kids fat, that is disproportionately affecting people of color. Where's the outrage? There's so much outrage for masking and people that are having house parties, but there's no outrage for the people that are intentionally going out and causing disease on themselves, and the companies and the politicians and the people behind driving this epidemic of heart disease. Where's the outrage? I mean, it's disappointing. Where's the outrage for cancer? So cancer killed 598,000 people in the year 2020. Where is the outrage for the chemical carcinogens that are in your drinking water? Where's the outrage for the chemical carcinogens that are in the foods that you buy, the food packaging, the BPA, the other endocrine disrupting chemicals that are carcinogenic? Where's the outrage for the chemical carcinogens that are in your bedding and your pillows? There's no outrage. There's no concern about this. You can go to Target right now and buy chemical carcinogens and think you're doing something healthy for yourself, but you're not. So if we add up 690,000 plus 598,000, that is 3.7 times more people that died compared to 345. Now, what do you think what do you think killed now, I'm not diminishing those 345,000 people that died. There was a lot of great people, I'm sure. I don't personally know anyone that has died from the vid, but there's a lot of people that did. So this is from the disease caused by SARS-CoV-2. So what I'm going to do here is just put SARS-CoV-2 infection. Now, it's important that we understand, according to the CDC's website, about 94 or 96% of the people that died had comorbidities like these: pre-existing cancer, heart disease, metabolic disease, obesity. So a super majority of the people that died had other conditions that made them more vulnerable, and those conditions are being completely ignored by policymakers, by public health experts, by the media. Where's the outrage for that omission of that evidence? Where's the outrage? There's outrage for young kids playing sports. There's outrage for children traveling on airplanes without facial coverings, and people are making viral videos for these families that have like a children with autism that doesn't want to put on a mask. Like, there's all this hyper focus on that, but there's no hyper focus on preventing our children from getting these diseases that are increasing the burden of the healthcare system. The people with these comorbid conditions, the obesity, the hypertension, they are having severe COVID and they are taking up space in the intensive care unit. Okay, so I'm not blaming them. I'm just saying, where's the outrage? Now, what I want to do here is put some deaths per capita here in different major counties in big states. Now, what we're going to do, because we hear a lot, people say, well, Mike, look, you're looking at this data wrong. There was only 345,000 because we did all this stuff. We did lockdowns, we did masking, we did distancing, because the politicians saved lives. Okay, well, if that was true, that would be reflected in the data. So I'll share with you a more bigger screen of this so you can actually see what I'm referring to. But what we're going to do here is look at, say, LA County. LA County had some of the most strict and earliest restrictions of any other county in the country. The state of California, in terms of closing businesses, outdoor and indoor mask mandates, 2 different lockdowns. Their deaths per capita are the same as New York. Okay, you're like, whoa, well, New York got hit hard and early, and California did everything right, and yet their deaths per capita, especially in LA, is significantly worse than states that have been completely open since May of 2020. And I'm talking about counties like Miami-Dade County. Miami-Dade County is in deaths per capita. And by the way, the state of Florida has the second oldest population in the entire country. The whole state. It's a very old population. We know age is a risk factor, whereas the state of California is one of the youngest, especially in LA County. So we got to keep in mind that if you look at Michigan, the state of Michigan has been on lockdown and all this. If you look at counties in Pennsylvania, counties in New Jersey, they are among the worst in the country. And they've been locked down early, hard, indoor and outdoor face mask mandates. In Pennsylvania, there was a mandate that you couldn't have more than 2 people from outside of your home. So anyway, if you compare those to Harris, Texas, which is Houston, the biggest county in Texas, and Harris County, and then also Miami-Dade, they are much lower than all of those counties that had super strict mandates. So the correlation between all of our safety measures and outcomes, if you just look at the data, it's not really there. So in a future video, what we're going to talk about is what we can do. We got to exercise. We have to focus on sleep and whole real foods. Friends, that's the solution. Continuing to hide from this now endemic pathogen, it's not going away. This thing is not going away. You need to improve your resilience. You can't just continue to hide behind double, triple masks and shields and all this stuff. Where is it going to end? How is that a way to live life when you're psychologically stressed and scared? That affects your immune system. So friends, I just want you to realize we have the data now. It's been over a year. We have the data. So let's make healthy living great again. That's the message, friends. I care about your life. I care about your friends and family's life. And we got to make healthy living part of the conversation. Exercise, resistance training, sleep, whole real foods. So hopefully I didn't irritate you too much, and I got you to think a little bit about some of the research and the data, and to think about different ways, and especially for our children. We can no longer keep our children out of school and feed them junk food and keep them sedentary on screens. That is absolutely wrecking kids. I get excited about this because I have a daughter. I'm sure you have kids as well. So friends, I want to thank you for tuning all the way into this video. Hopefully you enjoyed it. Hit that like button if you did. If you resonated with this video, please share this with someone that might resonate with this as well. And we will catch you on a future one down the road. Have a good one.